safety alert tonight. A new CDC report shows a growing number of children here in the U.S. are ending up in the emergency room due to cannabis edibles. Nashville doctors are seeing the same trend. Good evening and welcome to News 2 at 5. I'm Bob Mueller.
And I'm Haley Wilgus. News 2's Tori Gessner talked to a pediatric emergency physician who says most of these very young patients are accidentally ingesting edibles.
They look like candy, chocolate, and chips, but looks can be deceiving. What's really inside them is landing more kids in the ER.
They're very, very high doses of these edibles in very enticing, child-friendly appearing forms.
Dr. Marla Levine, a pediatric emergency physician, says she's seen an increase in the number of small kids coming to Monroe Carroll Jr. Children's Hospital at Vanderbilt after accidentally ingesting edibles. A single piece can cause serious symptoms, but Levine says a lot of children don't stop at just one.
They think it's a whole bag of Nerds, or they think it's a whole bag of Doritos, and they'll eat the whole thing, and then we get into very, very serious problems for these small children.
It's a growing issue nationwide, according to a new CDC study, revealing an uptick in the number of kids going to the hospital for marijuana-related health issues from 2019 to 2022. The largest jump in ER visits was in children under 11. In 2019, doctors saw an average of 21 kids who ingested weed every week. That number spiked to about 66 a week in 2022, a more than 200% increase. The CDC report doesn't list any reasons for the rise, but Levine can take some guesses.
I think because they have been available for purchase in places like delis and gas stations, I think that it somehow conveys that there isn't a danger to these products, and perhaps there isn't that vigilance in keeping these products safely out of reach of small children and within the home.
Levine says children who ingest too much marijuana can go in and out of consciousness, have trouble breathing, and even experience seizures. There are serious consequences to a preventable situation.
These are drugs, and we have to be as vigilant with these products as we would be with any other medication within the home, with any other dangerous product within the home. These have to be safely out of reach of children.
The study says kids 11 to 14 also saw a large spike in ER visits because of weed. Levine says it is important to note this problem will vary from state to state. Tennessee's experience with this issue likely looks much different than a state where marijuana is legal. Haley.